Okay, today I want to talk about thyroid. So I see a lot of patients, a lot of ladies with thyroid issues. So I just kind of want to educate you guys on that so that if you know somebody or you yourself have it, um, this will be pretty good information and you can discuss it with your doctor or your healthcare practitioner. Or if you want to have a health assessment with me, that'd be great. But anyway, I see a lot of thyroid and I'm going to share my screen with you. And so I see a lot of hypothyroidism due to Hashimoto's. So what is hypothyroidism? Right here, hypothyroidism is also known as underactive thyroid. It occurs when the gland obviously does not produce enough thyroid hormones, and it can create a lot of health issues. And this is what I had and my daughter had, and I see a lot of people with it. And so some of the common symptoms that they're going to have would be fatigue, they're tired, weight gain, that's a big one, increased sensitivity to cold, constipation, dry skin, pale face. They may have a hoarse voice, weakness, stiffness, they'll ache, joint pain. For women, they'll have irregular menstrual cycles. Thinning hair is huge. Um, it's a big one that I see with women. When I see their hair thinning, you'll see male pattern baldness in men, but when you see it in women, you kind of realize that it's probably thyroid issues. And most of them will be on thyroid medication. So most of these people have hypothyroidism. They're on medication, but they still have these symptoms. Okay, because Hashimoto's is an autoimmune disease, and we're going to talk about that later. So what causes this? Um, right off the bat, they're telling you Hashimoto's is the number one cause of hypothyroidism. It's an autoimmune disease. That means your body is attacking itself. And then the other ones are thyroid surgery or radiation can cause it. Certain medications, I see a lot with people who are on medication, iodine deficiency. That's why we check your micronutrients. And then if you have pituitary gland disorders or just congenital birth defects. But your main ones you're going to run into would be autoimmune Hashimoto's. Next would be medications and a maybe iodine deficiency, but that's typically what you're going to see. So here's something I wanted to share with you. 23 million Americans have hypothyroidism. So that's how many people are on active levothyroxine. That's the med that is T4 for hypothyroidism. Again, they're giving you thyroid hormone. That would be T4, which gets converted to T3. And I'll show you a diagram here later about that. Um, also, just wanted to go over with the misdiagnosis. If you look over here, misdiagnosis of thyroid conditions is a significant issue in the United States. This happened with me. I got misdiagnosed for years. Nobody would look at it until finally I had a functional medicine doctor say we should look at it. And then when we did look at it, they didn't want to check all the labs. Um, so it's estimated that 1/3 of our patients diagnosed with hypothyroidism may have been misdiagnosed. So this can lead them to being prescribed other medications for symptoms that are actually related to thyroid function dysfunction. So that happened with me when I went into the doctor. My symptoms wasn't thyroid. I didn't even know what thyroid symptoms were at the time. My symptoms were depression, anxiety, brain fog, like a mood disorder, and so obviously and concentration. So they put me on medication for that. So here it's just saying basically a misdiagnosis often occurs because symptoms of thyroid conditions such as fatigue, weight gain, depression, and other health-related issues might receive treatments for these symptoms without addressing the underlying thyroid condition. So if it's an autoimmune, which is what I treat, Hashimoto's, then we got to look at things a little differently, and we look at blood work in a whole different way. Okay, and I'll show you what we look for. Um, Again, these are some things you're going to run across. So those with hypothyroidism, um, here's what we're talking about hypothyroidism here. Um, Low mood, uh, they'll be slow. Their speech will start to go slow. That it's like they won't be able to think. They'll be constipated. They'll be feeling tired more than normal if they have thyroid issues. But here's some of the physical ones, and I didn't even know this when I went into a doctor and he looked at me, the functional medicine doctor. The first thing he did, it was really weird. He looked at my eyebrows, and if you see the outer third of my eyebrows, I don't really have an outer third eyebrow. He told me I had a thyroid issue before we ever even looked at my blood work. And I thought he was crazy because he looked at the outer third of my eyebrows and goes, "Oh, you got thyroid problems." And I was like, "What?" But anyway, and I had a puffy face and I was fatigued. Now my skin was never really dry. My voice was never really hoarse. I didn't have muscle weakness. I had high blood pressure. Um, and my cholesterol was a little high, but nothing to worry about. But I had a lot of these symptoms and I didn't even know it. And I was going to my doctor the whole time, and he wasn't paying attention to any of these. They were putting me on antidepressants, mood stabilizers, and they were putting me on ADD medication. So that's why I tell you, if your thyroid's off, I mean, it's going to throw a bunch of things off. So here's one that I found out: when you have Hashimoto's, that's the number one cause of hypothyroidism. It's very important to know about iodine, selenium, vitamin D, and the other one is gluten. And I, like I said, I didn't believe this until I got tested, but I was highly sensitive to gluten and wheat. And you have to test those differently. I know gluten comes from wheat, but they're different. And that's the test I run on people. But anyway, if you don't test all this stuff, you won't be able to help them. I mean, you need to know where the problem is. And I was really low on selenium and vitamin D. And if you look at me, my skin, it looks dark. And I get a lot of sun, but my vitamin D levels were like in the 40s. Now, my general practitioner, he said that was okay because it was above 30. If you're above 30, they don't look at it as being a problem. But I'm here to tell you, I try to get the patients I work with to a minimum of 70. I try to keep between 70 and 100 on vitamin D levels. And then we also, if we do a micronutrient test, we can look at iodine, we can look at selenium and other things. And we test exclusive, I mean, we really go deep diving on gluten because gluten is a big one on these people. And a lot of the doctors don't know that. And when I questioned, my primary care practitioner about these things, because I would go and Google search and come back and say, "Hey, what about this stuff?" They would always discount it and be like, "Nope, we're not going to change anything. Stay on the medication," and just basically shut me down. And so I didn't like that. So that's when I took it into my own hands to do this myself. And at the same time, I not only had Hashimoto's, my daughter had Hashimoto's. So we were getting the runaround from several doctors on this. And it wasn't until we met with a functional medicine doctor that we got these tests ran and got over it. So um, here's the here's the graph. I hope you guys can see this, but what we're looking at here is this is TSH. You got thyroid releasing hormone, thyroid stimulating hormone. They always check the thyroid stimulating hormone, and we'll get into numbers later. But this goes to T4, which is the non-active thyroid hormone, which goes to T3, which is the active hormone. Okay. So when they put you on medication, they put you on T4, which is the non-active hormone. It has to go to T3, and that's where iodine comes in, and that activates it to T3, which that's the active thyroid hormone. That goes into all your cells, and that's what makes things happen. So when people take thyroid medication right off the bat, they do feel a little better. I did feel a little better initially. I lost a little weight initially, but it never really fixed the problem because that wasn't the problem. Okay. My problem was I had vitamin deficiencies and I had autoimmune issues. And so when I run an autoimmune test, this is what I'm looking for down here, the thyroid. I'm looking for these thyroid globulin antibodies and thyroid peroxidase antibodies. And when you go, so if anything you walk away today, when you go to get your blood work done, once a year or however often you do it, I would tell you, have them check not only your TSH. I'll show you right here. Not only your TSH, but have them check your thyroid antibodies. And these are the two you want to check: a thyroid globulin antibody and a thyroid peroxidase antibody. If these are high, they should be zero. To be honest, they should be zero. And I'll show you what a test looks like. Mine were like 1200. Okay, and they didn't even want to check them. I had to force them to check them. Okay. So my TSH was 19, which is high because normal is like 1 to 5. Mine was 19. And they're like, "Oh my gosh, you got thyroid problems." And I go, "I know, I've been telling you guys that I'm not feeling it right." So we only found it because my functional medicine doctor told me to tell them to look for it. Okay. But other than that, I was on like 3 or 4 different medications and they were never going to look there. Okay. Because guys typically don't have thyroid problems. So when they do have them, they miss it totally. Women usually have it. It's usually 7-1 women over guys. But when you go to get your thyroid, they're going to get your thyroid tested. They're going to look at TSH. I would tell you have them look at the thyroid antibodies too. That's the most important thing is the TSH, and then look at these antibodies. Definitely get those checked. Okay. And here's what the test looks like that I do. We look at the thyroid and we look at these two antibodies. They're saying they're under 12, but on this person, they're both 0. That's perfect. That's good. This person does not have a thyroid autoimmune disease. So a lot of my patients will have it. These numbers will be way over here, almost on all the ones I see. Okay. And then, I also look at inflammation. I always have them test the C-reactive protein because if a person has thyroid problems, they're pretty much inflamed and they're over here. And that's why they have other health issues too. So those are the two you want to look at, thyroid globulin and thyroid peroxidase, along with your TSH. And then, when we look here, here's some of the problems. If Hashimoto's goes untreated, this is where it gets tricky. This is where I started having heart palpitations. My blood pressure was going up. They will have heart problems. They'll slow mental function. That's the brain fog, loss of sexual desire because their metabolism slow. Um, I don't know about the congenital disabilities. Mixed edema, I've never really seen that in anybody because that's where your organs shut down. It usually doesn't get that far. They'll usually find it before then. But the one that I have seen a lot of patients have is they'll have thyroid cancer and they'll have their thyroid radiated or removed. And even if they have their thyroid radiated, removed, they could still have thyroid problems and they still have to watch their food. And like I said, again, gluten is a huge one. That's why I tell just a lot of patients the best free advice I could give you would be get off grains. Um, and here's one where, you know, this is when it gets real bad. I was sweating quite a lot and my heart rate was going up and I felt like I was having anxiety, but it wasn't. And I would joke and I would say like I'm having a hot flash like a woman. Um, but I didn't know what it was. And I started to have some anxiety, but I never had anxiety before. So when I started having, the high blood pressure, I started sweating, I started, having anxiety, I started having brain fog. I didn't know what it was. And that's like I said, when I went to the doctor, it was just put me on medication. And so I try to stop all the nonsense and figure this out first with people because a lot of people have thyroid issues. If you're on thyroid medication, you have hypothyroidism. And again, it's probably caused by Hashimoto's, which that means it's an autoimmune disorder. That means your body's attacking your thyroid. Okay. So complications, if you guys have any questions, you can ask, but complications are goiter. That's why they're going to do an ultrasound on you and they're going to look at it. The other heart problems, there's probably a lot of people on medication for this. I know I was having heart issues. Like I said, they were wanting to put me on high blood pressure medication because that mental health issues. Yeah, they're going to have depression, anxiety, brain fog, things like that. Sexual and reproductive dysfunction. They're going to have low libido. A lot of women with thyroid issues don't get pregnant. And if they just look at the TSH may be normal and they'll never look at the antibodies, and those women will not get pregnant. I had a friend of mine, his wife never did get pregnant later on. They're in their 40s now. Found out she had thyroid issues, Hashimoto's, and he was asking me about it. I told him, yeah, she probably had it a long time ago. That's probably why they couldn't get pregnant. But no one looked there. You know, now she has full blown thyroid issues in her 40s. Well, that's probably why she couldn't get pregnant. I don't know for sure, but usually those thyroid antibodies show up 5 to 10 years or even longer before that TSH gets out of whack. Okay. So right here, poor pregnancy outcomes. That's so, and then mixed edema. This is the one that's life threatening. It usually doesn't get this far, um, unless it's totally neglected, but I've never heard of it. I mean, I've never had a patient that happened to because they're usually proactive trying to find out. And then if I had to pick a supplement for someone to get on, the one that I have, it's called advanced thyroid support. And what we're trying to do is we're trying to support your T3 and your T4 so you can make more of it. At the same time, we're giving you lifestyle changes and diet changes to kind of help this thing. But in this has a lot of good things in it. This has your vitamin B12, it has iodine, magnesium, zinc, manganese, selenium, which is very crucial for the thyroid, copper, molybdenum right here, has L-tyrosine, which is good. Um, it just has a lot of good things. All these are really good for the thyroid. So it's going to help with them being tired and sluggish, and it's going to help, it's just going to help their overall thyroid health. And then when we do this, there's other supplements I would have them on too, like vitamin D is a big one, and we look at glutathione, but I'm just picking the one right here that we use that's probably the best for the thyroid hormones. And then we, like I said, we get them on vitamin D. We'll either do glutathione, we'll change their lifestyle a little bit. And then we also, we look at their diet. So I'll look at food. And if they really want to know what's inflammatory, we do food sensitivity testing. And then we have them avoid those foods for a few months. And usually, I would say the majority, it's a high percentage, but I'd say the majority of those people respond really well to hypothyroidism or Hashimoto's. I know I did. I'm not on any medication today. Um, I was at one point on what, about at least 3 or 4 medications, including thyroid medication, and now I'm not on anything. So it can be turned around. It took me a long time to get off the thyroid medication, though. I struggled with that for years, and now I'm off of it. But if I was on thyroid medication or anyone's on that, that's not the worst thing to be on. But some of the other medications I was on for the brain fog, for the anxiety, depression, stuff like that, that was not good. So what happens is, and here's the thing, it's just funny. The other day I ate at a restaurant and I ate gluten on accident. They told me there was no gluten in it and I ate it on accident. And that was Saturday night. Well, here's how it works for me. On Sunday, I felt horrible. Couldn't hardly get off the couch. On Monday, I was out of it. And I get real moody when I do that. And I almost become, it's like Dr. Jekyll and Mr. Hyde. I get really moody. And my kids and my wife will tell you, like, what, Dad? So I get it on accident about 10 or 12 times a year, probably. But anyway, I was moody and out of it yesterday with brain fog. And then today's the first day I started to feel normal again. Okay. So it affects everybody different. I've had patients who, when they do eat gluten and they have Hashimoto's and they know they're not supposed to, it could take longer for them to get out of that funk. It might take a few weeks. I have one lady who did it, and she said it took her a few months. So, because gluten can stay in your system for up to 90 days. But if you do all the right things and you're supplementing and you're doing the lifestyle changes, and you're trying to avoid those inflammatory foods. So now, I mean, I'm trying to avoid the inflammatory foods, and every now and then on accident I'll get it, but I recover pretty quick because I'm pretty clean. I'm pretty clean like 99% of the time. So, um, you know, I I don't know. I just see so much of the thyroid. It's a shame that there's that much of it out there. And like I said, when you look here, they're saying what? How many people have it? 23 million. That's how many people are on medication. And that's just for one medication, levothyroxine. There's probably 7 or 8 different medications. So that's 23 million Americans on thyroid medication. And that's hypo. And what causes it? Hashimoto's. And what's the number one cause of Hashimoto's? Gluten. I mean, gluten is the number one. So when you talk to functional medicine guys, they know this, or functional medicine doctors, they'll know this. So I didn't know any of this stuff, but here's what I'm telling you. If you know anybody with thyroid issues, you know, it would be, it would be nice if you told them about someone who knew how to fix this, because they can go forever and just feel horrible and never get out of that funk and be on 5 or 10 different medications. Okay. And like I said, I was on meds. I'm no longer on meds and I feel better today. I always tell people I'm 51. I feel better than I did 10 years ago. And it's only because I changed. Now, did I like the change? No. It sucks not eating gluten, to be honest with you. But I'm over that now. And, it was really hard in the beginning. But, I was telling a lady the other day, she was really worried about going through it. And I said, you know what? How bad do you feel? She says, oh, I feel horrible. I can't go on like this much longer. And I'm like, okay, well then it's worth it to make the change. It's going to be harder to stay sick than get healthy. So I don't know. I treat a lot of thyroid. That's what I really like. That's what I'm passionate about. And I always run across it on people. So if you're on basically thyroid medication, you probably have Hashimoto's, and you probably, you'd benefit from, I mean, those people benefit from going through my program or going through a program like mine. But anyway, um, if anyone has any comments or anything, you can let me know. But there are tests you can run. And like I said, if you do the test, these are the ones you want to look for. You can't see that very well. I'll show you here. You want to have them when they run your TSH, they're going to look at TSH. And here's the other thing. TSH, they're going to put it at a level between 1 and 5. I would say you want to be really close between 1 and 2. That's optimal. If you start creeping up to 4 or 5, you're going to have some of those symptoms. They let you go a little too far, you know, getting up. I don't like people being above 3 on the TSH. So I like this to be about 1 to 2. And then when I look at the antibodies, I don't want to see any antibodies. If you see any antibodies, that means the thyroid's getting attacked, and that's not good. So this one is at 0. They're good, but most labs will allow, this one labs allows up to 12 or below. They'll call it normal. Some labs go as high as like 30 or 40, and that's not enough. I had a lady come in who was at 20, and she was a mess. And then they just go up and up and up. And what you're going to notice is the medication. They just, your medication, you start off at 30 micrograms, then you go to 60, then you go to 80 or whatever. And they just keep going up because no one ever changes what they're doing or what they're eating or what they're supplementing or their lifestyle. They don't change anything. And so when I get people in my program, what I notice is their thyroid medication will go down, and they'll go back to their doctor and they'll start saying, hey, I'm starting to get anxious, and I'm starting to have my heart's starting to flutter. Well, that means they're on too much medication at that point, because what we're doing is working and they don't require all that medication. So they will go down. I try to get them off of it. You can't always get them off of it, but you can usually bring them down off of it. Okay. And like I said, it's the number one medication prescribed in the United States. It's like what, 23 million people just on levothyroxine. So if they're on levo, they've probably got Hashimoto's, because that's the number one cause. And the number one thing that causes that is gluten. And nobody, um, I got a research paper in here I thought I had. Hang on. Maybe I missed it. I had a research paper in here. Oh, here it is right here. Um, so they're right here telling you that Hashimoto's thyroiditis is an autoimmune and dietary management issue. But no, if you go to an endocrinologist or medical, they won't talk about this. And this is right off PubMed. And there's hundreds of articles about this. I mean, right here, it says right here, the use of diet low in gluten. So they're saying go low in gluten. I'm telling you, get off gluten, you know, get off of it. And then I can test for gluten in wheat too. And that's a whole other story. We can talk about that some other time. But anyway, I just wanted to get this information out because a lot of people don't know this stuff. And I feel like the more I can educate you on this, the better. And like I said, this helped with my brain fog and my anxiety and everything, my mood disorder. Oh, weight too. I lost like 40 pounds, not to mention, I mean, and it just comes off and it just stays off because you're not eating the bad things. You're not getting inflamed. So, and my blood pressure went down, no more blood pressure issues. So, just trying to be healthy and do the right things. That's what I would suggest. It's not always easy, but if you have somebody who knows, I've treated hundreds of people with this. So now I kind of know what to do. And there's a few deviations you got to do. Some people don't do well with iodine. Some people do. Some people don't, you know, need more vitamin D or more selenium and some other things, or glutathione. So you just kind of got to gauge it on. It takes a few months to really help them out. But within 3 or 4 months, you can get to feeling really good. You can turn this around pretty quick. And these people have been suffering for years. Okay. So, I mean, I see women who've come in, they've been on thyroid meds for years. And now it's just getting to the point where they go back to the doctor and they're still having symptoms, and he's not willing to talk about it, or she's not willing to talk about it. And they're like, they're not listening to me anymore, and I'm getting worse. And that's exactly what happened to me. So I just like to help people with this. If you know anyone who has it, like I said, you might share this information with them. But this is one, when you get your thyroid, when you get your blood work done, have them look at your thyroid, the TSH, and also have them look at the thyroid antibodies, both of them, thyroid globulin antibodies and thyroid peroxidase antibodies. And if you have those, call me. Call me. Don't be waiting around, because this doesn't go away on its own. I promise you. It's just not a good thing to come down with. I wouldn't wish it upon anybody. And so, anyway, I hope this information was helpful, ladies, and I'll bring you something again next week. Okay. Have a good one.